I'm Dr. Brad Ingrao, hearing aids expert for SeniorLiving.Org. In this video, we're going to talk about something that's a little different from our typical videos on hearing care and hearing aids, and that's the difference between a hearing aid and a cochlear implant. Somewhere around 90% of people with hearing loss are best treated with high-quality hearing aids. And if you look at a lot of the videos we have here on SeniorLiving.org, you'll see how that process works. For the majority of those people, hearing aids fit by qualified professionals using qualified standards of care result in a significant improvement in communication and reduction in a lot of the health-related quality of life negative impacts of hearing loss. However, there are a significant number of people for whom even the best hearing aids fit by the most qualified providers don't allow them to access speech information well enough to really effectively communicate. And that's where cochlear implants come in. So here we have a picture of a typical hearing aid, and you'll see that the entire device sort of fits on the outside of the body. There's the earpiece, and in many cases this is a rubber dome, or it could be a custom ear mold, and that goes down inside the ear canal. And then there's either a tube or a wire going back to the actual hearing aid itself. Sound goes into the hearing aid using microphones, and then a digital audio processor amplifies that sound in a way that's prescribed by your hearing care professional to attempt to compensate for your hearing loss in terms of volume and also in terms of helping you clarify the signal. That amplified sound then travels to your ear down that wire, out of a speaker, and you hear. For most people, they understand in a quiet room very, very well, and in some background noise, there's a little bit of a reduction, but they still hear well enough to function communicatively and have a conversation. Here's a picture of a cochlear implant, and you'll notice there's actually two parts. There's the outside part, and that kind of looks like a hearing aid. And then there's an inside part, and the inside part is the actual implant. So that implant is placed inside the inner ear, the part of the inner ear called the cochlea. That's where all the magic happens. And that electrode array, that's the long curly part at the end of the wire, that will actually stimulate the nerve fibers of the auditory nerve, sending sound up to the brain. But before we get down there, we have to do what we did with hearing aids, which is capture the sound. So if we look at the other part of this device that looks like a hearing aid, that's called a speech processor. The speech processor also has microphones, and it collects sound very much like a hearing aid. But the big difference is, rather than creating a sound, the cochlear implant processor creates a set of instructions. Now those instructions are then sent to the internal device using radio waves that travel through the skin. So that small part at the end of the wire, that circular part, is called a coil, and that coil will actually attach itself to your skin using a magnet. On the inside of the skin is another magnet, and that part is called the receiver stimulator. So the coil and the receiver stimulator marry up using those magnets, and then those radio waves travel through the skin, providing instructions for the actual implant to then send a signal down that electrode array and fire in very specific locations and patterns so that your auditory nerve or your hearing nerve can actually get the signal up to your brain. So they're not that different, but in fact they are very, very different. People who can benefit from hearing aids will generally see almost an immediate improvement hearing speech in quiet, and over a very short period of time will begin to improve their ability to hear with background noise. Now, sometimes those hearing aids will have multiple programs to assist with that or assistive technology, but in general, it's a pretty quick improvement. With cochlear implants, it's a much longer time to get that same improvement. And the other thing that's different about them is how we evaluate and how we measure them. So for hearing aids, we do a typical hearing test. You've seen this graph before. Hopefully when you had your hearing evaluated, they gave you a copy of it. And that graph will show us how much amplification you need at different pitches to get to that, hey, I can hear it better now and it's pretty clear. With cochlear implants, we don't spend as much time with that graph, but instead we focus on how well do you understand words. And in your hearing test for your hearing aids, you had a test where you heard through earphones a man say the word car, say the word jar, that sort of thing. That's called speech discrimination, but without a hearing aid. When we evaluate for cochlear implants, what we're trying to determine is, even with the best fitted hearing aids, are you able to understand well enough to effectively communicate? And with the current set of FDA guidelines for the products that are available, that means roughly 60% of the words correct when presented in sentences with some background noise. Now, each individual insurance company has slightly different criteria, but that's pretty close to the criteria. In addition, each individual cochlear implant center may have slightly different procedures, but that's the general idea. So we first fit you with hearing aids, and we do everything that we can in order to maximize your ability to hear and understand with hearing aids. If you still struggle and you still say, you know, I hear, but I don't really understand, then at that point we would evaluate you for a cochlear implant. And the test is not that dissimilar to the say the word test, with the exception of the sound now coming through a loudspeaker rather than the earphones, and generally being sentence material rather than individual words. The other big difference between those two tests is, for your cochlear implant evaluation, you'll be wearing your hearing aids. Now, many times they'll do one set of sentences with both hearing aids in, and then they'll take one hearing aid out and do just one ear and then flip and do the other ear. The reason we do this is we want to determine, is there one ear that can still function well with a hearing aid, and the other ear, that's the one that really does need the implant, or are both ears really problematic? And that will help you and your audiologist and your surgeon decide which ear should be implanted first. With adults, we generally implant one ear at a time and leave a hearing aid on the other side. This is called bimodal hearing. And the nice thing about this is, when you qualify for a cochlear implant, what we're learning is that even though the sound is loud enough to hear, you're not understanding the words. Cochlear implants are really good at fixing that problem over time. Hearing aids are really bad at that. Once you get to that level of hearing loss, the hearing aids simply can't make it better. It can only make it less bad. That's a term I borrowed from my uncle, who was a hearing care professional a long time ago. But cochlear implants are not great at really low frequency hearing, and they're not great at some of the richness of sound that hearing aids are really good at. And so if we have a cochlear implant on one ear that allows us to hear speech clearly and accurately, and we have a hearing aid on the other side that allows us to hear the richness and fullness of sound, putting those two together on the same person gives a nice round comprehensive picture of the auditory world. So that's called bimodal. Getting a cochlear implant is not as fast as getting a hearing aid. You can go into a hearing care provider and walk out the same day with hearing aids. Cochlear implants require several months of evaluations. You'll also usually be introduced to other people who have cochlear implants, and then you'll be introduced to a surgeon who will do some imaging studies, generally a CT scan or an MRI, sometimes both. And using those images, they will determine which of your inner ears is better suited anatomy-wise for the implant. And then using that information and the testing information, we'll sit down with you and make a plan, which ear, and so forth. Currently in the United States, as of the day of this video, there are 3 companies with FDA approval to provide cochlear implants to children and adults, and those are in alphabetical order. Advanced Bionics, and Advanced Bionics is a part of the parent group called Sonova, which also includes Phonak. So Phonak hearing aids and Advanced Bionics cochlear implants are designed to work directly together. Cochlear, which has a partnership, a slightly different partnership with ReSound, so some of their accessories work together and their pairings to cell phones and so forth work together. And the third is called Medel. Medel doesn't have any direct connections like that, but they work with all hearing aids through telecoils and compatibility with things like the Phonak Roger system. There is currently, as of September 2021, a pre-market authorization for Oticon Medical to provide a cochlear implant in the United States. So eventually there will be 4 in the United States, and as part of their process of getting FDA approval, all of them go through rigorous testing for both safety and effectiveness. And so they have to prove that their implant will in fact improve your hearing. So getting a cochlear implant is not, gee, well, I don't like my hearing aids, so I better go get a cochlear implant. However, the candidacy has changed significantly, and so if you're struggling with hearing aids, it's probably worth your while to ask your audiologist, should I be screened for cochlear implant candidacy? Now, if they say, well, you have to be completely deaf for a cochlear implant, that suggests that they might not necessarily be up to speed on cochlear implant candidacy. All 3 manufacturers have very extensive websites with great contact information on them, and you can check out their information, and all 3 of them also have mentors that can connect with you and explain the process from the perspective of somebody who already has a cochlear implant. In addition, they all have professional teams that will answer diagnostic questions or specific questions, and will even work with your personal audiologist if your audiologist wants to add those services to their clinic. So you don't necessarily have to abandon your audiologist that's helped you with hearing aids all these years in order to get a cochlear implant. So this is a situation where it's not a quick fix. It's not the, oh, I'll just get a cochlear implant. But in my clinical practice, I often hear people say, hey, you know, I heard about this thing called a cochlear implant. What is it? So we wanted to make this video just to give you a little bit of information about the differences between them. Certainly before you look at a cochlear implant, you should make sure that your hearing aids are tuned up, that you're really hearing the best you can with your hearing aids. And we have several videos about how to do that here on the site. So if this is something that's interesting to you, you could also drop us a line, and the site will forward any questions to me if there's more specific. Personally, as an audiologist, I've worked with cochlear implants since the late 1990s and have seen them evolve over time. And so they're not as easy as hearing aids, but they're not as difficult as they used to be. So if you're struggling, if you're really having a hard time, talk with your audiologist, find out more information. And if it's the right move for you, the vast majority of people who get cochlear implants after about a year of rehabilitation do significantly better than they did with hearing aids. So hopefully this was helpful, and we'll see you in the next video.